Hello, everybody. Welcome to today's live webinar. Thank you for joining us today. I hope you can hear me loud and clear. I'm Michela Fassi, Communication Manager at Milestone, and I'll be your moderator for today's webinar. This webinar is dedicated to the following topic: how to eliminate the operator exposure to formalin in the operating theaters. And we will discuss this topic with a guest speaker from Helios Wuppertal in Germany. Before leaving the floor to the speakers, I just want to focus your attention a few seconds on the features of the Zoom platform through which we are broadcasting. I bet you are familiar with Zoom. Anyway, the meeting controls are at the bottom of your window. They hide if you don't use them, and they reappear if you move your mouse. You have the chat box. You can use the chat box if you want to write to me if you have any technical problem. Also, there's the Q&A box. We encourage you to ask a question anytime during the webinar, and we will have a live Q&A session at the end of the presentation, so you could address your question directly to the speakers. So please feel free to type as many questions as you want. There is also a vertical line dividing the PowerPoint and the speaker webcam. You can move the vertical line to the left or to the right to choose which window to make bigger. Now let's take a quick look at today's speakers. We will first have an introduction by Gianluca Micheletti, Area Manager at Milestone, and then our guest speaker, Mr. Ralph Lieberz, will talk about his experience with the UltraSAFE unit. Now I think it's time to start. This webinar will be recorded and the slides will flow automatically during the webinar, so you just need to enjoy the presentations. So Gianluca, I think it's time to start and I give you the floor.
Welcome, everybody. Gianluca Micheletti, good morning and good afternoon. I'm very glad to do today the welcome speech of this very interesting webinar. Before starting and leaving the floor to our guest speaker, I'd like to talk a few minutes about Milestone, just to let you know, and to whom does not yet ask, what we do and who we are. And I'll be describing Milestone. Sorry, describing Milestone as we started 30 years ago in 1998, establishing the division of healthy chemists. So we applied some techniques for preparation of samples before further analysis. Then, a few years later, after having collected some knowledge about sample preparation, we have opened the second division, the medical line, and starting to develop our own product and instruments, ending up to release and patent our innovative product. Few years after we started, we opened up also our branch sister company in the US. And then 6 years ago, we opened up a new production plant due to the increasing success of our line. And just this year, we opened up our new Milestone Innovation Center, from where we are now broadcasting this webinar. Our motto, our credo is to offer a complete line of innovative analytical instruments for histology and pathology laboratories. So for answering the untold needs the laboratory has about documentation, traceability, standardization, fixation, declassification, all these topics that in the past were not well developed and taken into consideration. Indeed, when we started, we humbly started with some units for tissue processing mostly. And then with the year, we have increased our portfolio with now up to 8 categories covering the diversity of topics, including macrodigital, frozen sections, and also sample handling, the topic that we are now going through this webinar. With sample handling, what we mean is the handling of tissues, samples, biopsies from the time they are taken from the body to the pathology laboratory. So this line includes small devices like a FormSafe, which is a pre-filled vial with formalin, with a protective layer on top, avoiding the operator to breathe and touch formalin. And devices like TissueSafe Plus and SealSafe Plus that works with under vacuum bags, double sealed under vacuum bags for transporting tissues either fresh or in a preset formalin ratio. And now, and today's topic, the UltraSAFE, which is an automatic formalin dispensing system for buckets. For pouring the exact quantity of formalin every day, operator is independent. With a motto that is common to all these solutions, the zero formalin exposure, because from the starting, from where the tissue is in the operating room, moved into bags or into buckets, automatically filled with formalin and sealed for good, till the pathology laboratory, when they open the buckets or the bags and they start the grossing, accessioning, and working on these tissues. Why we have this zero formalin motto? Because, formalin in the past was suspicious to be carcinogenic, but nowadays is proved and carcinogenic to humans class 1 by the European Commission. So every employer has the duty to minimize the exposure to this dangerous and carcinogenic solution, and so that to eliminate this substance as much as possible. If not possible, the employer is asked and called to have it limited exposure to the operators in a closed system, in a vented environment, to minimize the worker exposition to the less possible. And of course, constantly monitor the efficacy and the effect on the body, on the worker's health. In doing this, we have developed our UltraSAFE system. Now, I'm very glad to give the stage to our guest speaker, Mr. Ralph Lieberz, that have had the UltraSAFE on trial because they have a project going on, and today it's a current user of this device. Mr. Lieberz, if you're ready, I leave you the stage. I give you the presentation, so I stop mine.
Thank you very much. I'm ready.
And then you can start.
Okay. So, fine. Thank you, Gianluca, for the kind introduction. It's a great pleasure for me to be with you today in our webinar, and would like to welcome everybody to my little talk here from Wuppertal, Germany. I want to split my talk in 2 topics. First, as Gianluca described just before, the important point of the employee safety in the operating theater, operating room. And second, the pathology for the diagnostics, very important, a few words about the fixation samples of specimen. As you all know, is a standard for fixation, very important for an optimal diagnostic. So if you think about biomarkers like HER2 or estrogen or like PD-L1, the immunohistochemistry, or if you think about molecular biology, next generation sequencing, precision medicine, it's very important to have an optimal pre-analytics. And the beginning is not in the pathology department. The beginning of this optimal p-analytics of this standard is at the surgery, in the operating theater, in the operating room. So we have two challenges. Challenge number one is to reduce the formalin exposure in the operating theaters, and not only in the pathology department. That is checked by the authorities, by the government and the pathology department since many years. But now, you know, in former times, the surgical staff has to fill up the buckets with formalin, large buckets, 1 liter, 2 liter, 3 liter, up to 5 liters. That's really a problem for the safety. As Gianluca described just before, we have since 2016 a classification for formaldehyde in the European Union. It's carcinogenic and it's suspicious for germ cell mutation. So it's our job to minimize the formalin exposure. As you have heard, I'm from Wuppertal in Germany, and in Germany we have some regulations. The exposure limit is determined by law. And if the exposure with formalin is too high, you have to do a lot of things. You have to mark danger areas. You have to implement access restriction. You can take or have to take technical protective measures. And you have to maintain database for each employee. That means you have to record, to document every working day from the beginning to the end, and for each employee, the exposure with formalin. If you want to go to a CAP accreditation, for example, College of American Pathologists, then that is a checklist requirement, not only a regulation by law. You have to do that every day. And you need occupational health care. So we can say in summary, employee safety is really a leadership task. In former times, the buckets were cleaned in the pathology department, and then they was, as I described before, filled in the operating theaters and the operating rooms. And now we want to take our leadership task and we want safety for the employees. The second challenge is the gold standard for fixation. You know the gold standard for fixation is 4% buffered formalin solution. Everything is known in 4% buffered because 4% is the correct solution. If the solution is too high, you see a lot of artifacts in your tissue. If the solution is too low, you have a bad morphology too. The best pH is between 6.8 and 7.2, like water, as you know. It's very important that you have no acid during your fixation. Yeah, it's very, very important. I want to show you the influence on the fixation, on the morphology in the next two slides. You see a lymph node, you see a germinal center, and the staining is H&E. What do you think about this section? Do you think that's a good morphology? Do you think that's a good and optimal staining? I don't think so. The H&E staining has no contrast. If you look at the cells have shrunk. We have a lot of artifacts and the section is too thick. Please look at the next slide. The next slide is from the same patient, the same lymph node. You can see the germinal center, you can see the B cell and the T cell region, and now you have a good morphology. The H&E staining is okay, is well done. The section is not too thick. And if you ask your histotechs in the pathology department, they will tell you it's much easier to prepare a thin section. Why? Because now we have an optimal fixation. the correct solution, an optimal pH, and an optimal amount of formalin. That's very important too. You have to think about the optimal amount of formalin for your specimen size. So we have two challenges: the employee safety on one hand, and the standardization for the pre-analytics for the fixation on the other hand. And I have good news for you. There's a solution for our two challenges. That's the Milestone UltraSAFE systems. We are working now since 2 years with the system. We have done a study. We want to publish that in the next few months. And we have around about 60 employees in our operating rooms and theaters. And I can tell you, and it's no joke, the people are happy with the system because there is no exposure outside the box, outside the system. That was checked by the authorities, that was checked by the government, and the exposure is super zero, yeah? And the system, the instrument is very easy to use, and it's very easy to clean. In the next few slides, I want to show you how to use the UltraSAFE system in our operating room. Here you see a tissue in a single-use UltraSAFE bucket, and there are different bucket sizes on the market. I think Gianluca will show you that later in detail. And then you can scan the bucket barcode, you activate the bucket. It's very important for data reasons. And then you have to place the bucket inside the box, the closed box, and then you can press start. Then the system fills the bucket with the optimal amount of formalin. Very important, as I described before, with the optimal solution and the optimal pH for standardized fixation. You can see here's a closed box. You can see the dispenser, and there's no exposure outside the box. At the end, you will have a data sheet with all informations like date, time, case ID, bucket ID, and at the end, the amount of formalin. So, in summary, we can say the UltraSAFE is the optimal instrument to reduce the formalin exposure in the surgery, in the operating room, in the operating theaters. We have a standardized fixation with all necessary informations I described. There's a possibility to implement for track and trace, and you have an interface to your hospital information systems if you want to do order and entry. And with this slide, I will come to an end. You can see the Wuppertaler Schwebebahn. This is a unique train for public transport, unique in the whole world, above the little river Wupper. And I want to thank you very much for your attention. Ganz herzlichen Dank von Wuppertal hier in Deutschland, in Germany. And we will go back to Gianluca. Thank you very much.
Thank you very much, Mr. Lieberz, for the very, very interesting presentation. Now it's my duty to make the final speech and a kind of a little summary with a live demonstration of the units. I'm glad to see what you mentioned during your presentation, and actually those was the 5 crucial points we wanted the unit to have before getting to the market. And we learned that from customers like you, Mr. Lieberz, and from your staff, that we actually got these points. So UltraSAFE has definitely safety, automation, and ergonomics to the operator. So for full protection to the operator's daily work, and also documentation traceability for the safety of the sample. So it's completely traced and documented for what we call the chain of custody. so that what happened to your tissues can be documented and reported into the file, into the folder of a certain case. Besides this, why we are safe? Because the system is fully equipped with charcoal and HEPA filter on board and can be connected to a ventilation present in the laboratory in the OR. The bucket is specially designed, and we have different sizes of that, for having no spillages, no fumes, no contamination as well, because the valve is a no-return valve. The samples, when placed into the buckets at the operating room, will be closed for good into the container, and nobody else is required to open and pour formalin inside, preventing then exposure but also contamination. Is standardized and quality proof because always the same right amount of formalin dispensed by the unit, and all will be written into the report on paper, on sticky label, and sent to the laboratory information system. And it's a walk-away system, no user action at all. It's a fully automatic system. UltraSAFE starts a journey for us, a journey that helps the traceability of every details about your sample. So in the sample connection, we have our system, but we have also other checkpoints, other stages where we check how and where my samples are at the accessioning level, but also at the grossing too, at the cassette scanning where we prepare the run, and at the processing, and more to come. Of course, displaying and describing all these steps needs other webinars, so I invite you to book your personal experience in our laboratory. Just set time, date, units, modality, and we will be prepared for you for showing what you request in a kind of personalized and dedicated webinar session. Now, for example, I'm doing a brief demonstration. Here we have buckets, and we have prepared a sample. In this case, is a kidney placed straight away into the buckets in the OR, and the operator is just required to close the bucket for good. So nobody else will open it, touch it, make anything with my cases. Then going into the in front of the unit and telling the unit by the barcode, unit barcode printed on the cover, that I'm about to use the system, the case ID, so that all these details will be sent to the database and to the LIS, and then place the bucket into the vented cabinet. In this case, you can place the container anywhere you want, because it will be automatic centering and automatically poured and filled with formalin. I select the ratio, and the automation takes over. So the arm goes down, centering the bucket and pouring formalin into the container. Formalin is taken from the drawer here that allows the operator to have up to 4 containers. So then when the first gets empty, the second takes over, and so on. Moreover, if you have larger bulk tanks or a reservoir in the next door, behind the unit there is a special connector to get this large container connected as well. When the operation is finished, the arm goes back home, and a printed label is automatically done, and the system and the data sent to the LIS. The operator has to just open the vented cabinet, close the special valve here, and get the sticky label attached to the container in this way. Now the system, the assembly is ready to be transported to the pathology laboratory. I do trust this brief demonstration explain you correctly what you wanted to see from our side. Now, I again invite you to book your personal experience, but before this, it's now time to go ahead with the question and answers. So I asked my colleague Michela to collect questions because I saw that in the chat has already arrived some. Am I correct, Michela?
Yeah, correct, Gianluca. We have already received some questions. So if you have any other question to address to Mr. Ralph and to Gianluca, now it's the time to type them in the Q&A box. So I will start with a question for you, Gianluca.
Yeah.
Because an attendee asks how many sizes of the buckets are available. So maybe you show different buckets we have.
Exactly. Here we have on display the buckets available for the unit. We go from the little one, 0, it's a 0.5 liter. Then going further up with the 1 liter, the 3 liter, the 5 liters, and the big one, 10 liters container. The 1, the 3, the 5 are available also in transparent version, so the people can see inside, like this one, can see inside how is the tissue, how is the volume, because often workers in the OR and the pathology are very visual, so they want to see the level. And so that we thought to have these buckets also in the transparent version. So 0.5, 1, 3, 5, and 10.
Thank you. Now I have a question for Mr. Ralph.
Okay.
Okay, can UltraSAFE be useful to check cold ischemia time?
Yes, of course. As you know, the cold ischemia time is very, very important if you think about biomarkers like HER2 or estrogen or PD-L1, for example, or Ki67, and so on in the immunohistochemistry. And you have to define the time when the fixation starts. Yeah, normally it's a huge problem because the people have to write the time on the data sheet, for example, and that's not possible. In Germany, it's not possible that the colleagues in the surgery will do that. So UltraSAFE will record the correct starting time of the fixation. And as you know, if you want to validate, for example, a biomarker, you have to check the quality of your fixation, because that's very important. You have to check it by 20 positive cases and 20 negative cases. And if you think about HER2, for example, breast cancer, and the discussion about HER2 low, the fixation is very, very important in the future for that question. So yes, UltraSAFE is very helpful to record and to document the ischemia time. Thank you.
Thank you again, Mr. Ralph. I think this question now goes to Gianluca. Gianluca, how does the unit have an audible alarm when complete?
Yeah, I confirm there is an audible alarm. And I don't know if you have heard when I finished the previous run, there was a beep. In addition to that, because the system can be connected into the laboratory network, you can also have a visual alarm and a visual message on a board, on a laboratory PC, or to an external service box to make everybody warn that the system has completed. But the procedure takes a few seconds or 1 minute, so it's very quick.
Yeah, you already answered to the next question. Okay. That was how long does it take to process, how long does the run take?
Yeah, so you see, I did live demo now, it was a few seconds. I used the 1 liter container. Of course, when you have to fill up 5 liters or more, it takes some more time. But I would say from a few seconds to a couple of minutes.
Yes.
You confirm?
Yeah, I can confirm too, yes.
And your staff, your people in the OR has some feedback about this, Ralph?
Yeah, because they are very happy. Because, normally they have to pre-fill a lot of buckets with different sizes, as you know. with all the problems we described. But normally it takes only half a minute or so at the instrument. So they are very happy with that. Yeah.
Okay, I have another question. Gianluca and Ralph, you can decide who wants to answer. I mean, probably we need to repeat the workflow, because the question is, you put the sample in the UltraSAFE bucket, add formalin, and then the pathologist can cut the tissue? That's the question.
That's right, yes. Add formalin, then you have to transport the bucket with the tissue and the right amount of formalin to the pathology department, and then you can start the grossing after the fixation comes to an end. Not at the same time, but I think it's clear.
Exactly, respecting the fixation time, right?
Yes, that's right.
In practical terms, yes, in the OR, they place the tissue dry, so without any liquid, into the bucket. They close the cover like this, and then the system, the assembly like that, goes into the UltraSAFE for automatic dispensing of formalin inside it. Respecting the ratio, we tell the system.
And Gianluca, speaking about the ratio, there is another question related to this one. What is the correct volume ratio? Someone
Very interesting question, because it's a long time debate questions. And if you look at the textbook, you see 1:10, 1:15, 1:20, which is correct for some extent, for small biopsies, for regional medium-sized biopsy. And of course, Ralph, just correct me because you are in the field every day. But if it is a matter of a kidney, and to be filled with 1:10, 1:20, it's basically impossible. So the reality is that, proved by experience, is that 1:2, 3, 4, 5 is a sufficient quantity of formalin for being used to transport the tissues. And once in the laboratory can rework and adapt to the size.
I totally agree. Yeah.
Okay.
Right. Yeah. Thank you.
Perfect. I have a last question for you both. Again, you decide who wants to answer. We have an attendee who says, I'm from an histology laboratory. Can the leads, the cover, the leads from the buckets be opened and closed as many times as wanted, or could they only be opened once?
Yeah, I can answer to this, Ralph. So the cover is closed like that, and for the first time there is a tamper evident mark. So if someone want to open the cover for the first time, they have to break this tamper evidence, but then the cover can open and close as many times as they want, as a regular bucket.
Yeah, but as one point for me, as we told, normally the bucket is for one tissue, it's single use. Yes, and think about IVDR, for example. It's very important that we think about our buckets. It's not really good. It's class A. And if you look at the classification for IVDR, the buckets are class A. And in the future, the buckets must be single use. It is not possible to clean the bucket and to use it once more again.
Sure. Yeah. This of course goes absolutely yes. I was just mentioning that it's possible to close it, but absolutely avoid to use this bucket for another tissue, because we got this question pretty much many times, and the question is, as Ralph said, if you reuse it, you have to clean it, disinfect, be sure that no protein left into from the previous tissues. So it's more work, more time consuming, more ecologically not friendly procedure at the end. And of course, not recommended by VDR, CAP, and so on.
That's right, yeah.
Perfect. I think time is running out, so we have just few questions left, but we will reply via email, either Gianluca or Ralph, depending on the question and the topic. So let me just show a final PowerPoint with useful information for everybody. Here you can see our contacts. You can contact us if you want to schedule a customized virtual demo. As Gianluca already told you, our specialists are available to explain and show all our units from the lab and answer to your specific needs. Also, if you want to send specific questions to Mr. Ralph, please send them to us, and we will forward the questions and the comments to Mr. Ralph, who will reply directly to you. And of course, if you want to receive any additional material for us, please do not hesitate to ask. Finally, if you want to retrieve our webinars of the past, you can find all our webinar series on our website, and here is the direct link. And we invite you to follow us on our social channels to stay up to date with our news, events, and future webinars. So thank you, everybody, again. Thank you very much, Mr. Ralph, for your time and for your comments and presentation. Thank you, Gianluca.
We very much appreciated your presence, Ralph.
Thank you very much. It was a pleasure for me. Thank you.
Thank you to all the attendees, and see you next time. Goodbye.
See you.
Bye.
Goodbye.
Bye.
Ciao.